Everyone, my name is Andrew Arellano. I'm with the Margarita Humanitarian Foundation. We are a nonprofit organization serving the Antelope Valley. We will be serving the undeserved community with health services. Today, I'll be presenting you guys with the type 2 diabetes. We'll be learning about what it is, how to treat it, how to manage it, and ways to prevent it. Introduction to type 2 diabetes. Type 2 diabetes is a chronic disease that affects the pancreas when a person's pancreas is not able to produce enough insulin. This leads to abnormal levels of blood sugar and insulin resistance. Insulin resistance is the resistance to the hormone insulin. I'll touch more on this in the next slide. More than 34 million Americans have diabetes type 1 and 2. Approximately 90 to 95% of them have type 2 diabetes. Type 2 diabetes most often develops in people over age 45, but more children, teens, and young adults are also developing it every day. So what is type 2 diabetes? Type 2 diabetes is a disease that occurs when your blood sugar is too high. Blood glucose is our main source of energy, and it comes from the foods we eat every day. Insulin, which is a hormone made by the pancreas, high glucose from food gets into your cells to be used for energy. So insulin resistance is the body's cells don't respond normally to insulin. Glucose can't enter the cells as easily, so it builds up in the blood. This can eventually lead to type 2 diabetes. Fast food is so popular nowadays, and unfortunately, that's one of the biggest factors to getting insulin resistance. So why do people get type 2 diabetes? Usually there are different factors as to why an individual may get type 2 diabetes. Type 2 diabetes usually begins with insulin resistance, like I said, a condition in which muscle, liver, and fat cells do not use insulin well. Our genetics may play a role in developing diabetes. If a family member has a disease, you might also be more likely to develop it in the future. Having extra weight most of the time is a big cause. Bad communication between ourselves, being of age 45 and older, smoking, and having metabolic syndrome, which is high blood sugar, extra fat around the waist, high blood pressure, and high cholesterol and triglycerides. You may not have heard of triglycerides. So triglycerides are a type of fat around that are found in your blood. When you eat, your body converts any calories it doesn't need to use right away into triglycerides. The triglycerides are stored in your fat cells. Later, hormones release triglycerides for energy between meals. If you regularly eat more calories than you burn, particularly from high carbohydrate foods, you may have high triglycerides, which is called hypertriglyceridemia. How can we prevent type 2 diabetes? There are a number of ways we could prevent it. Number one, get more physical activity. Number two, get plenty of fiber. Number three, go for whole grain foods. Number four, lose extra weight. Losing extra weight can make a big difference. Number five, skip trendy diets and just choose healthier eating options. So the reason I say skip trendy diets is because a lot of people do the keto diet or the paleo diet, and it does work, but once you give it up, you gain all your weight back. So just choosing healthier eating options may do a big difference. Number six, check your A1C level every 1 to 2 years at a doctor office. The A1C test is also known as the hemoglobin A1C or HbA1c. It's a simple blood test that measures your average blood sugar over the past 3 months. It's one of the commonly used tests to diagnose diabetes and prediabetes. If you have diabetes, you should check it every 6 months to know whether you are maintaining your blood sugar levels. Number seven, sometimes natural supplements may work, such as multivitamins, or taking cinnamon supplements may help prevent diabetes, but talk to your doctor about that. And number eight, do not smoke. Now, how does one treat type 2 diabetes? Well, unfortunately, diabetes is a chronic disease and you cannot cure it, but the good news is it's manageable and it's pretty easy to manage. Just lose the extra weight, stay fit, exercise regularly, stop smoking, cut back on carbs, and make healthier eating choices. Regularly check your blood sugar levels, medication if everything else is not working or not manageable. So if you don't have severe type 2 diabetes, your doctor may allow you to just manage it by eating healthy and exercising, taking care of yourself. But if those options are not working for you, then medication usually helps. And always stay in contact with your doctor for your regular health screenings. And blood glucose monitors at home are very helpful, and your doctor will tell you what the normal blood sugar levels are so you know how to maintain yourself and when you're overeating sugars and carbs. So that is it for today, and these are my references in case you were interested in looking up anything that I mentioned.